Okay, next we've got Elsie Dale. She's 85, widowed. Recent discharge from hospital with chest.
The point of the Community Hub is that we identify people who are coming towards some sort of crisis or who are frail, and we get a team together who can discuss that person and try and make sure that everything that is supposed to happen happens in a very person-centred way.
Sepsis and an infected leg ulcer, type 2 diabetes, newly diagnosed dementia. She lives with her granddaughter Anne. Her daughter's on holiday. She's had multiple new medications on discharge, new social care package, TDS visits from carers. DN's doing insulin twice a day and leg ulcer management. She's also on warfarin, so she has INR monitoring. She's got quite an extensive past medical history. So it says pharmacy notes have been red flagged as not ordering repeat meds regularly. Doesn't always seem to take it as prescribed, won't let carers in or eat the food they prepare, and leg ulcers don't seem to be healing particularly well.
So we've discussed this with her granddaughter to see if the granddaughter can help with the BM.
If you've got a little bit of memory problems, your mobility isn't too good, and you're taking lots of tablets, and you get a minor infection, that can have major effects on you, whereas it wouldn't have an effect on other people. And there are lots of people who are like that, and if we can identify those people in advance so that we can maximise their health, make sure that they're associated to their society and they live, they're not lonely and they're not isolated, and that they've got good support, then those people can withstand those adverse events better.
Medicines, and I think we really need to review these to find out exactly what she really needs and what she's actually taking. So I think it would be good for me or one of my team to go to see her to actually get a better idea of that. In terms of the medication, she's got lots of medications that will be making her drowsy.
We do something called a comprehensive geriatric assessment, which is all aspects of somebody's life, whether that's the medical side, the social side, the psychological side. And then there's really good evidence that if you can do that in a multidisciplinary way, then you can reduce admissions to hospital and reduce admissions to care homes. You can even live longer.
This lady's not known to us, but I think referral to intermediate care would be appropriate for a balance assessment, possibly looking at mobility aids, what her pre-morbid level of activity was. We could also get her up to the rehabilitation unit for socialisation as well as balance class exercises.
And 17 years old, is it realistic to rely on her to give insulin twice a day? We would still be responsible for the giving of the insulin, but I was hoping that she might be able to persuade her that she knows her, she's friendly, and therefore she might respond better to her.
We have people from the health service and people from social services and people from what we call the voluntary sector. We have Alistair, he's a local GP, and he represents the GP practices that we work with in Whitstable. We've got Helen, who's a complex care nurse who works with me in the community frailty team. Leslie, who is a community nurse. And we have Martin, is a pharmacist. We also have Tiffany, who works for the intermediate care team, so they're the sort of physiotherapists and occupational therapists who can visit somebody at home. And also she works with the rapid response team. Mary works for Kent County Council and is the person who reflects the social services side of our work. We have Lisa from the mental health team. She's not here today, but again, a lot of our patients have cognitive impairments and dementia, and it's absolutely key that we work together. Paul from Red Zebra, they're our social prescribing colleagues who know absolutely everything that's available in the community, and also Nicola, and she works for Age UK, and she's called a personal independence coordinator. And then we're all coordinated by Debbie Matcham, who is our health and social care coordinator.
Pharmacy team are going to go in and assess medication, frailty team to do a comprehensive geriatric assessment, social services, both for the carer but also for the patient. Age UK, arranging meals on wheels and getting a dementia link worker to support, and also the ICT team to assess from a mobility point of view. And everyone obviously bear in mind the potential for capacity issues during your own assessments as well.
One of the real advantages of the hub is that the skills of all the people around, we all begin to learn a little bit of what other people do, so that you don't have endless different people coming to ask you the same questions. So I think as a patient, if you have a feeling that people are coordinated and communicating about you and with you, then that's a much better place to be.